going to doctors like themselves. For example, Said ibn al-Hassan of the 11th century complained, and I'm going to read his quote because it's too good. I can't paraphrase this. How amazing is it that patients hand over their lives to senile old women? For most people at the onset of illness, use as their physicians either their wives, mothers, or aunts, or some other female member of their family, or one of their female neighbors. The patient then acquiesces to whatever extravagant measures she might order, consumes whatever she prepares for him, and listens to what she says, and obeys her more than he obeys the physician. So here this quote, I read it word for word because it is so rich. It is so rich. It tells us so much about the climate. People were preferring to go to female doctors. And they weren't just these old senile women, aguza, that the doctor was referring to. Women were also nurses, they were healers, they were midwives, and midwives, they really dominated the field of reproduction, obviously, but midwives didn't just treat women's reproductive issues. They basically treated them from head to toe. So let me wrap up by explaining, if we now know they dominated this field, how did they disappear? And the answer lies in the emergence of modern medicine. When the pharmaceutical industry appeared and modern doctors became schooled by westernized modern technologies, they actively started a campaign to discredit these women, because many of these women used natural herbs, spices, potions, plants, oils to treat all kinds of ailments for both women, men and women. And the modern medical industry, the state wanted people to go to male doctors and use medication made in a factory. And isn't it interesting today, and maybe we can pick this up in the Q&A, that people are realizing the limitations of modern medicine, and they are returning to the natural remedies and practices of ancient medical systems like Ayurveda in India, traditional Chinese medicine. They're realizing that modern medicine only treats the symptoms and not the emotional root causes of these diseases and illnesses. So thanks to these alternative sources, historians of women and gender have been able to reclaim this history and learn that actually women were the majority of medical and healing treatment. They were the preferred for the population until probably around the early 20th century. It took states in the Middle East a long time to discredit these women and to put them on the margins, but they never disappeared. Those of you living in the region, you only have to talk to people, go out to the village, and see that many people continue to consult these kinds of medical experts. So if I have a minute to leave you with two questions that maybe we can pick up in the Q&A, but as this panel is full of brilliant women who are reclaiming their place in the field of medicine, I've also noticed that the arrival of, or the reemergence of traditional healing systems. In America and Egypt, my two countries, this is all the rave, Ayurveda and traditional Chinese medicine. What I'm noticing is that men are also leaving the traditional field of medicine and moving into these more natural healing practices. So it almost feels like there's more of a balance and perhaps, hopefully, equal opportunity for everyone. Thank you so much.
Thank you, Dr. Hanan. Dr. Hawa, please. We're gonna start off our discussion with a little fireside chat with Her Excellency Dr. Hawa. And I'm going to start off by asking you to perhaps reflect on what we heard from Dr. Hanan, and specifically because I also think you touched upon it in your own way, this erasure of history or women's place in it, right? We start in the UAE, we start from 1971. We don't really talk about
It's as if there was a black hole before,
Yeah.
and, we just appeared in 71 magically. Yeah. So yeah, it was thank you for that talk. It was very good. It was very informative, and it really made me smile because the good doctor touched upon very important points. One of the things that I found interesting is that people think all medications are, okay, where do you think medications come from? Give you a little secret. A lot of them come from the environment. They're natural. They come in, they're modified in some fashion, but the original source is what can be defined as traditional medicine. So that's just one little tidbit I always found interesting. The second thing is, I kind of, in my own mind, I separate between medicine in the way I was trained in that sense, in the clinical Western sense. I put that aside. And then there's what I call holistic care. A person isn't just a bunch of organs. I said just. You are a bunch of organs, but you're not just that. You are a person that might be stressed. You're a person that, you feel detached from the world. You have so many different facets that you're just treating. My finger hurts. Here's some Panadol. What about the rest of you? And I've actually, it's interesting, that we have a long history in this, because I've actually applied that principle in my own care. Like when you come to my clinic, my patients always tell me, your smile is half of the treatment. It's because I don't even use the word marid, which when translated means the sick. Patient is sick in Arabic. I don't use that word.
Yeah.
I use person. The person came to me for advice, not the sick. You might not be sick. And I treat you like a human being. You have a job. I always ask, so what do you do? It's not because I'm curious about what you do. I'm curious about what your lifestyle is. I ask you about, do you have kids? Because that adds some stressors. I just get to know you as a whole human being. And you're absolutely right. Modern medicine has realized the benefits holistic care can give. Everything from yoga. I just recently discovered yoga, by the way. I always knew yoga was good, but I admitted I was one of those pessimists that made fun of my friends. So basically, you're too froofy and classy and lazy to actually go work out. So you're going to do this modern thing, this yoga thing, which obviously is not modern. It's been here for a long time. And then one day, after my 2 kids, I started aging, and my joints started hurting, and I didn't understand why. You're laughing, I see. And my friend was like, you have to try yoga. I was like, oh, fine, I give up. I was taking a Panadol every day. I woke up and popped the Panadol. I was that sore. 2 sessions. And I never needed a Panadol in the morning again.
Wow.
I'm a believer. So both by history and by what we know, and also by admittedly personal experience, no one's perfect, it's really important. A person is a whole being. It's not just that one thing.
What you're saying, and when we talk about that wholeness, it sort of reminds me about how we think about the SDGs, for example. And what me and the team here have been trying to push forward is to look at the SDGs with goal number 5, which is about gender equality and women's empowerment, as the mother of all SDGs, as the thing that would allow us to unlock everything. And adopting that perspective means that you're no longer looking at issues in a siloed manner. Right?
Brilliant.
And I feel that perhaps this is many people are not going to agree with me.
Say it, do it.
But perhaps this is a very feminine way of looking at things, because when you look at women's roles in societies, like women in medicine, they looked at the whole picture, right? They were mothers, they were sisters, they were healers, they did it all. When you look at the role of women in, you know, climate change, for example, the reason that they are impacted so much more than men, and their response is so much more effective in a sense, is because they understand, they have a different relationship to the earth, they have a different relationship to the community, and I wonder if this is something that we should, how do we bring that back into our thinking, because there's going to be a lot of resistance.
I love this topic. I'm smiling. There are several words there that just, I just love. Silo. We don't live in a silo. I use the word bubble. It's the same concept. I say it all the time. My patients, if you're watching, you're probably smiling too. You can't treat, the same way you can't treat a person like they live in a bubble, it's not realistic to think you're not going to get stressed. We all have stressors in life. We got to live with that. So you don't live in a bubble. About the perspective of women and their connection to the world, that is why it's always beneficial on any team, in any discussion, in any project, to have women. And I've heard people say, oh, the female perspective, or the feminist touch, the feminine touch. And they say it in hushed tones. Why? Is there something weak about having a feminine touch? No. So how do we bring the positivity of that to the forefront? I'll tell you, every day, with every person you talk to, with everything that you do not, in hushed tones, say the feminine touch. You say it out loud and proud. You realize you start associating it with something positive. And actually, if I may, I'll give you a beautiful anecdote that just came to mind. There is an individual, I will not name, that is well versed in poetry. A man. A traditional Emirati Arab Muslim man. Telling me the story about an interaction that he had, and a woman had made a bit of a mistake. She was a manager and something went wrong, and she, out of politeness, calls him. And she says, I apologize, blah, 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 whatever it was. You know, us girls, we're kind of silly sometimes. And I expected that to be the end of the story. Do you know what he said to her back? He said, daughter, never say that again. Never associate being a woman with being silly or something negative. You're not doing a credit to yourself nor to every other woman here. I know women that are قد العشر رجال. I know women that are like 10 men. Don't ever say that to me again. Wow. Now that's the key to bringing it to the forefront. Every day of everything we say, do not associate it with something bad. Start associating with a positive. You should be glad you have a woman on this board, because I'm going to give you the perspectives you guys didn't think of. Diversity. Why are the companies that are the most diverse the most successful? I dare you, look up the Fortune 500 companies. Look up the composition of their boards. They take advice. They listen to diverse populations and individuals.
Yep. That's an ingredient for success.
Yeah.
And that's what we're learning now, and it's amazing. I mean, there's a part of me that feels slighted because we still have to justify it, right? We still have to.
And it's almost like a habit. It's even when you don't mean it, some people just do it. They don't even realize what they're saying. So without being unpleasant or without being annoying, you gain them on your team. You don't build animosity.
Yeah.
Build relationships. Turn it into a positive.
Yeah, absolutely. Going back to the field of healthcare and reclaiming our space. And I want to get into more of that Femtech sector and get your views. I mean, you said something really interesting. Women's needs have always been there. But I think the beauty of what we're doing and what we're seeing today, especially in our part of the world, is that women are taking the reins and reclaiming that space, as Dr. Hanan would say. And so with that, I want to bring up our two panelists. We have Dr. Sara and Dr. Lina, Dr. Sara Khurram and Lina Shadid, who are joining us. And I believe they're online. They couldn't be with us physically today, but their opinions and their contributions are very important. And they are leading young women who are delivering on changing the scope, the space of healthcare. And as we move into the digital world, as we move into a more virtual space, it comforts me, it reassures me to know that we have women like Lina Shadid, sorry, like Dr. Sara, who are taking the lead, who are thinking of women's needs within their communities, within their space. So let's bring them up. There we are. I have a huge bio for each of them, but I'm going to ask them to introduce themselves. They'll do it much better than I ever will. So Lina, we'll start with you, and then we'll move on to Dr. Sara. Please tell us about yourselves, what you're doing, and then we'll open up the convo.
Great. Can you hear me?
Yes.
Perfect. Hi, Assalamu alaikum, and thank you very much for the invite to be part of this esteemed panelist. Dr. Hawa, great presentation and a great talk, really inspiring. So my name is Lina Shadid. I'm here from the Legion. I lived all my life in Abu Dhabi, like Dr. Hawa maybe. And I started my career wanting to be a doctor. And at that time, my father said, no, it's too much work. And why do you want it? So I ended up studying electronic and computer engineering. And that's where I started my career. And I went back to healthcare, and I became the healthcare leader of one of the largest tech companies in the world. So I was the vice president of IBM in healthcare. And I spent the last 25 years building digital health applications and using artificial intelligence and innovation to help healthcare providers, to help patients manage their lives, manage their well-being, manage their mental health, and manage their day-to-day challenges. And I'm here with you to share some of these work, some of the achievements, some of the challenges. So happy to be here with you. Today, I run a very dynamic healthcare consulting business with PwC in the Middle East. So again, helping regulators, helping hospitals transform using digital innovation and transformation across the Middle East.
Thank you, Lina. Dr. Sara, tell us about yourself.
Hello and assalamu alaikum, everyone. I'm really, really glad to be here today. I think I was warmed by Dr. Hawa's presentation, her keynote. I also have two daughters, and there's so many things I could relate with. And also Dr. Hanan, as she explained the history. I come from Pakistan. I am a medical doctor by profession. I was a radiologist in my past life, and that kind of connects to my journey, which I'll explain during my talk. I started Sehat Kahani, which means story of health. It's a telemedicine platform that is run by women, led by women, for patients in Pakistan using technology. After I started my company, I did my master's in health policy and management, pregnant with my second child. I've crossed the bridge from coming from a very traditional middle-class family in Pakistan, very conservative middle-class family in Pakistan, to a mompreneur or a doctorpreneur today that runs a company of more than 250 people and 7,000 primarily female doctors. So I want to tell you about the work that we've done in Pakistan, how we've changed life for a lot of female doctors, as well as a lot of patients in the country of all sectors, and my challenges, my struggles, and some very, very great achievements that we've had as a team of female founders and female doctors. I'm very, very glad to be here. Thank you.
Thank you, Dr. Sada. Considering all the work that you are doing, I think my first question to both of you is, as the healthcare space moves into a more digital space, and obviously it's only going to continue to do so, do you find yourself in a minority? Do you find that not only because you're women, but because you are Muslim women, Arab women, operating from a completely different part of the world that is not Silicon Valley, right? Do you find that there are challenges that you have to deal with?
Do you want me to answer?
Sure.
So let me go to a point you brought just in. Silicon Valley, is there challenges with digital health for women there? And the answer is for sure. So digital health and women is not a straightforward topic. If you look at what's happening today, less than 10% of all investments going into Silicon Valley in digital health is going for women-related apps. And if you see the level of presentation of women on owning, like Dr. Sarah, businesses in digital health, it's less than 5%. So it's not a Middle East issue, it's a global issue. Half of the population are women, yet 10% of all the investment in digital health, and we've seen double the investment that went from 200 billion to 400 billion over COVID, only 10% went to women health-related issues. And if you ask me, we always focus on the same topics. When it comes to women health, it's either pregnancy tracking or other related topics. There's so many other things that, from a holistic point of view, like Dr. Hawa mentioned, that we should be looking at. And I think this is not Middle East. I mean, unfortunately, Middle East, Pakistan, and the South region is even behind when it comes to digital health for women. If you look at it, there is mental health issues, huge issues. I mean, COVID on its own doubled the women mental health issues globally, like more than 50 million mental health issues, depression, women depression in 2020, just because of COVID. So if you think about it, we have issues, and these issues are not addressed globally when it comes to digital health for women. In our region, it's even much worse. Menopause, end of life, cervical cancer. There is very, very limited applications globally that address these other issues other than pregnancy and periods. But look at the Middle East, you will hardly find any of these applications. And that's why we have to do a lot more as investors, as startups, as innovators, as clinicians who are interested in bringing more digital health solutions in their domains. Why we don't start that? And so it is globally a big issue. Yes, Femtech and this big wave started 3 years back, but unfortunately, every time I look at it, it's in very limited areas. Wellness and diet tracking, pregnancy, and that's it. What about everything else that a woman lives through? That's why I believe there's a lot more to be done, globally and in the region.
Absolutely. Is this on? Yes. I want to talk about what the UAE is doing, and maybe Dr. Hawa, you could tell us how the UAE is supporting, because I know that we are really pushing Femtech forward. Could you tell us more?
I'm just thinking about what was just said, because it was right on the ball. I think one of the biggest issues is, and what the UAE is trying to change to help the sector, is a destigmatization, or removing the stigma of talking about certain things. There are cultural norms that kind of have women not talking about things. Like, it's almost like you have to keep it to yourself and not complain a lot of times. I think there's very strong efforts in spreading the word, making people more aware of this, has really borne fruit. I had a male patient come to my clinic, older, probably in his 60s. And he was telling me about how he thinks his wife is suffering with menopause. He actually said the words. He was a little awkward, but he found the strength and the bravery to talk about it. And he mentioned the government's efforts. He said, well, we've now been taught that it's okay to talk about it. And he was asking me for the best ways to open the subject with his wife. So if that's not real life evidence of the fruit of some of these, efforts, then I don't know what is. That is the typical Arab culture man actually changing the way he behaves, not just talking about it, he's actually going out and doing something about it. And I think that that is the key to what was mentioned, one of the reasons why people don't pay attention. Because a lot of these decisions are made by men. A lot of these companies are led by men. They don't even know what these issues are. They might not be even doing it on purpose. I mean, I've heard a lot of CEOs and big bosses say, oh, this is an untapped market. Yes, they're talking about money, but money can be a good way to get to what you want. But they actually don't know what they're asking. They're getting all these studies. They're like, oh, please tell me what a woman needs. A part of that, and I'm really proud to say that the UAE is at the forefront of, is destigmatizing. Just talk about it. Just ask a woman, whether it's in a physician's clinic or whether it is in business meeting. These conversations are starting to happen. I didn't hear them that much when I was a kid or when I was a teenager. But now I'm in board meetings when this comes up. And that's the key to changing, everything you just talked about. And I think that is what the UAE is doing really, really, really well, is challenging those preconceived notions, challenging people to ask the questions. And yes, there's an economic perspective behind it where you can actually leverage an entire half of the population's market in healthcare and digital development.
My ex-boss, the former executive director of UN Women, used to say, a good law that sits next to negative social norms means nothing.
Absolutely.
And I think that we in the UAE have been successful because we have recognized this. We have made the investments, we have changed the laws, but we have also advanced the narrative.
And that's the key.
Yeah.
Absolutely.
I want to turn back to Dr. Sada. From your perspective, what are perhaps some of the challenges that you have faced in setting up your company? But I also feel like you might have stories to tell us about the successes that you have found by providing the service.
I think my whole company or the organization that I've set up, which is called Sehat Kahani, and for many of you in the room, it means story of health in Urdu, in our national language, is around a very big challenge that is very particular and very interesting to how Pakistan is. So I'm a medical doctor, and Pakistan is the 5th largest population in the world. We are 200 million people. And for those people, we have around 200,000 doctors, which means we have one doctor for 100,000 people. But the interesting thing is that Pakistan's total medical workforce is made up 63% by female doctors. So we love making our daughters doctors. And if you ask any middle-class family in Pakistan who has a daughter, they will say that they want their daughter to become a doctor because it raises your social stature in society. It makes you more respectable and noble. And in the end, it gives you a good hand in marriage, which is very, very important in our part of the world to have by 24, 25. So when I was growing up, I had no other option than to become a doctor. I was the youngest of 2 brothers. And when I entered medical school, I realized that 90% of my class out of 300 students was female. But what I saw during my years of medical college was that the same women who were getting positions in their medical college and who had studied 15, 16 years of their life to become a doctor started talking about marriage and children and started falling out. And in actuality, only 20% of the female doctors enter formal workforce. which in turn creates a huge vacuum in Pakistan of working doctors because your majority is sitting at home. And we have a term for it. It's called the doctor bride phenomena in Pakistan. So they're getting the best hand in marriage and getting married into the good families, but they're not working. And what it's doing for the population is that for this huge population, 50% of people don't get access to a doctor in their lifetime. They go to dispensers or quacks or faith healers or midwives in the community who are becoming doctors by default, but they don't get to go to a real doctor. And as you go in the rural areas, the condition becomes worse and worse. And this leads to a lot of malpractice, malnegligence, and the dearth of it is faced by the women, children, and the elderly who are far away because of accessibility issues, far away from cities where the tertiary care hospitals are, where the actual doctors are sitting. So it's a vicious cycle, which is going around in Pakistan. And there was a point in my life where I became a doctor bride and I couldn't work after the birth of my first daughter. But I was also raised by parents and in a family where I was considered no less to be a son. So I knew that I had to work. And when I couldn't figure out how to work physically, I developed a solution that allowed me to start working as a medical doctor from my home. So what I created was that a large network of female doctors from their homes can connect to patients in far-off communities using telemedicine. And when I started this, it was upgrading traditional clinics in low-income communities into telemedicine centers. So there's a nurse who sits physically and she connects a patient to an online doctor. I used to tell this to my family, friends, and peers. I used to ask people to give me clinics, and they used to laugh at my face because for them to believe that a female doctor sitting at home providing consultations was an absolutely alien idea. And how much of that do we do now? All COVID patients and patients generally are treated by online doctors. But imagine 7 years before in a country like Pakistan to be discussing that idea by a woman who is 26 years old. It was absolutely alien. So there were so many challenges. When I started the company, I was one person. I had a female co-founder. I remember when people used to come and hear my pitch to set up my company or to ask for funding, they literally used to ask me, where is the man in the board? Where is the man in this story? It was so difficult for them to believe that there are two female doctors who are building a company by female doctors for patients. I had so many questions asked while building up my business that, why are you doing this? You don't know technology. Why only female doctors? What do you have against men? And when we started making these clinics, we realized that healthcare is not just an issue for the low income. So we also made an app that works for urban populations today, that corporates use today, that the government uses today, which eventually impacted around 700,000 patients and housed 6,000 plus female doctors. So the challenge that I faced as a female founder in my country, and I think that is the challenge that globally all female founders faced, was the challenge of growing and scaling. Because there's so many good ideas that are founded by females and females in the healthcare space, but there is this unavailability of funding or growth funding available for female-led companies in Pakistan or globally or regionally as well, that does a disservice to growth and scale. So that was and still remains my biggest challenge, was to scale my company and grow at a level where my male counterparts are growing. I think success in this is that I got to represent my sector, the healthcare sector in Pakistan at so many global levels because of few champions that I got from men and women in my country and globally, which led me to believe that if you're doing something innovative, if you are passionate about it, if you're growing, if it's working, eventually you'll find support from circles that will cheer you on, and you have to block the noise that keeps you away from going to your purpose or meeting your purpose. I think today also, I've developed a sound network and a community of people who cheer me on. I think that's my biggest success. But there are certain challenges when I'm a room full of men in my country explaining what I do. There's still some raised eyebrows. There's still some notions. Did she get lucky? How did she do this? But at the end of the day, I'm very proud of something that I've built in Pakistan, and I hope that we can bring this outside Pakistan to other countries as well.
Thank you. I hope so too. It sounds amazing, and we certainly will follow your successes and hope to see you grow. I don't want to dominate the whole conversations. I'm sure our audience will have questions for you. So I do want to open up the floor. And okay, 5 minutes, got it. So I do want to open up the floor. If any of our audience members, physically or virtually, have a questions, please do let us know. I see we have a question there.
Hi, assalamu alaikum.
Walaikum salam.
My name is Tasnima, and I have two questions. So my first question is that, is there any wisdom in changing the medical curriculum right now to include more traditional medicine? Because that is, for example, I'm a medical student, so is there any wisdom to that in changing the curriculum so we can include more of these studies, more of some of the lost knowledge that we have?
Oh, okay, I can take that. So, to be just careful with definitions, the short answer is yes. And the other part of that answer is it's already happening. Not everywhere, but it is happening. The only hesitation I have is that any treatment that in official programs is being trained into these students has to have some research studies behind it, has to have some sort of evidence of benefit, and definitely evidence of no harm. The Hippocratic Oath, above all, do no harm. So as long as these are holistic therapies that are proven to cause no harm, proven to show some sort of benefit. I'm not just saying numbers in lab tests. I mean benefit. You feel better. You know what? If my patient feels better by sitting near the ocean and looking at it and leaves it positive, well, it's working. Is that officially a therapy? No. It doesn't do harm, and the patient benefits. Great. So yes, I just a little careful about what to let in, because there's also some let's just say habits that actually do cause harm. So that's my only caveat, but the answer is yes, it's already happening. And the first step to making any change, and I think the UAE knows this very well, is to change people's minds. And that's already happening. People already admit that yes, holistic medicine does a good job.
Thank you. Do you have a follow-up question?
Just a different topic, not the exact topic, but thank you so much for your answer. The second question that I have, it's something that I have been struggling with for the past few years. So the question is, I'm a daughter of an expat who lives here. So there are lots of perceived barriers whether we can actually rise in fields of healthcare and government to actually influence and help our own people. So are there any such barriers like this? And if not, how can we actually overcome those barriers?
Is that for me?
I'll come back to you, Dr. Hawa, but maybe, Lina, you live in Abu Dhabi, and you're first generation.
Yes.
So were there any barriers that you faced?
Answer that.
Yeah.
Honestly, I would say 100% no. On the contrary, I mean, my father worked as a doctor in UAE, in Abu Dhabi for 30 years. Extremely happy, no issues. I lived there. I studied in the same field. I followed his steps. And I think healthcare is open for everyone. And I don't see any issues. On the contrary, I see female growing in healthcare in UAE much more than any other country around the world, maybe. I mean, when I walk in Department of Health Abu Dhabi or DHA, and I see the number of female leaders there, I only feel proud. I mean, when you look at it, 10 years back, I used to be the only female in any meeting that has to do with digital health. And I would be like the Chinese person who is speaking something that no one else believes in. And fast forward to today, it's completely different. So healthcare is there for everyone. And living there all my life, I don't see any issue.
Dr. Hawa, do you want to add to that?
Oh no, Kafi Wafi. COVID showed that we're a team. And there's no difference between UAE national or resident, and I think leadership has made that crystal clear. And I really felt the spirit of teamwork, especially during COVID, and I could not be more proud.
Yeah, I agree. So take heart and know that success is possible and that you will be able to achieve. And I think that not only do I feel lucky, but I think somebody like you should recognize how fortunate we all are to live in a place that is inclusive and tolerant and that wants the best for everybody.
Yes, thank you so much. Thank you so much.
Any other questions? Yes.
Hi, thank you all for the talks today. A couple times midwives were mentioned, so I just want to bring that up slightly. And you had just mentioned now, Dr. Hawa, about changing minds a bit. Do you think there's room in the UAE for midwives to take more prominence? Because the evidence does show that their care for low-risk women is actually excelling. And what's your opinion on that? And changing the mindset of the doctors only being the ones to be able to care.
First, I want to say welcome back.
Thank you.
Thanks for coming. Dr. Hawa.
So absolutely a resounding yes. Midwives throughout history, not that I'm an expert, have always been very important, and they remain so. Yes, modern medicine, if I may be so bold, had migrated a bit away from the midwife concept, but is very quickly coming back again. What I would like to see is the regulation of midwives just as much as physicians, because they're just as important, but at the same time they can do just as much harm. So my only concern, again, above all, do no harm, is the quality of the training. So absolutely yes, I would increase the training programs, I would check on their quality, I would make sure they're up to par with the latest data, I would do licensing, I would do everything, I was regulated, and I would plug it in everywhere, because midwives are fantastic. Anyone that ever delivered knows that, but then again, if you bump into that one person that's not qualified, it could be a nightmare. But a resounding yes to your question.
Can I just add a point to that?
Sure.
So I think because I also come from a part of the world where there's a heavy dependence on midwives when it comes to female care, and they have proved to be very, very successful. One thing that I've noticed in digital healthcare interventions, and again, I'm not an expert, it's something that I've seen in my country, is whenever digital healthcare interventions are taught, midwives are somehow treated as these middlemen that need to be removed. So we talk about direct doctor to patient interaction, but in many parts of even my country, and I'm sure globally as well, the physical person who's present in the community almost all the time is a midwife. And I just want to second Dr. Hawa's comment that it's so important to take them in this journey of digital healthcare innovation in our countries, to equip them, to train them. And these are smart women in communities who have spent 14, 15 years of their life at least building that infrastructure for themselves. Everyone in the community knows them. So one of our models enables a community healthcare worker, and in 90% of the cases, it's a midwife, to use the telemedicine system in her clinic and connect to a doctor. But it was so difficult for us to make people understand outside the community how important that midwife is to champion our work and how easy it was to train her. So absolutely, if we can train and work on the quality of midwifery, especially in South Asian and low-income countries, there have been proven models in Bangladesh how quickly the maternal child health indicators improve because of these community interventions. But the key is to not leave them behind, to not eliminate their purpose, but to synergize their purpose in digital healthcare interventions.
And if I may just add one point, I absolutely agree. And another key point to achieve that is the word, people shy from money. Insurance coverage and payment of the services of a midwife. The recognition of the importance of a midwife and pushing it to the importance that it should have also comes from reimbursement and insurance coverages and policies, and that's really important. Sometimes people shy away from that subject, but it's really important. It's on the ground, and if you can cover that, then immediately the midwifery also, it helps it go up in terms of importance.
Absolutely. So we go back to a question of policy.
No.
Dr. Hanan, were you
Yes.
trying to say something?
I was. As a historian on board, I would just love to share a brief reminder that midwives were the women who delivered babies until about 100 years ago, when modern medicine moved childbirth into the hospital. And just the same time that the modern state and modern doctors tried to displace women from this field, the same time the state was using these women as their chief doctors in court cases, police records, when an autopsy needed to be done, when a sex crime had been committed, who do you think they went to? They didn't go to medical doctors. They went to the midwives. So there, as Dr. Hawa was saying, there is this, or maybe she wasn't saying, maybe it's what I read into it, but there is this kind of uneasy relationship with midwives. On the one hand, they are valued and respected. On the one hand, modern medicine is concerned to make sure they're up to date on regulations, the knowledge. So just a reminder that midwives were the ones delivering babies, and millions, none of us would be here if it weren't for the midwives, right?
If I may add to that, it's not just a male and female matter, even though you're absolutely right, and I love your historical perspective, because I'm a history buff. It's also a matter of, I suppose, kind of ego, if I may dare say that. There's other powers or pulling happening. It's this age-old story, nurse versus doctor, doctor versus nurse, versus midwife, versus who's up on that hierarchy. It's a hierarchical thing too. And that is another cultural shift we need to do. When we train students, we can't train medical students to think, to think they're gods, okay? We just can't, because that's when you make mistakes. Same way we can't do that with nurses either. There needs to be a team effort and a recognition of specifically the importance of midwives in that whole hierarchy. So that's another challenge that we have, which is culture, but it's the culture of medicine.
But it would be interesting, I think, that's a whole other conversation, to really explore, you know, when we talk about modern medicine, these modern institutions that we have set up for ourselves, and what are the elements that have made them what they are. They're built on a hierarchical system. They're built on, you know, one over the other, and there's power in that and oppression.
Yeah. It's a whole other hierarchy.
Right? And it's like this whole idea that the modern has erased the traditional, and the traditional doesn't count.
I love it. Modern is associated with better. Why? By the way, ever since I was a kid, I loved that question. Why? I annoyed my teachers to no end. Why? Is modern really always better?
Mm-hmm.
That's a question one should ask themselves too.
We're going to ask ourselves that and get back to you.
Good.
Unfortunately, I think we're out of time. Yes, we're out of time, but if there's no other burning questions, okay, we have a burning question from my own team.
There's a question from the virtual audience, so I'm just going to read it out.
Sure.
So it goes, given the rapid advance of future technologies, what do you all see as the biggest opportunity for women healthcare, or for women's healthcare?
That's a good question. Thank you. Lina.
You want me to answer? Yes. I would say if we manage to put virtual care, like virtual clinics, with early artificial intelligence detection to solve women's specific issues, whether it is around mental health, helping them being diagnosed and treated over virtual care, or it is to solve a specific problem like early detection of cervical cancer. So things that are only for women, that's where the real value for women health will be. Early detection, prevention, using artificial intelligence, using virtual care, using all these sensors that we are in a world that we live in today. We have a huge potential for us to improve in these areas, locally and globally.
But we need women to design them, right?
Yeah.
Yeah.
100%. And that's exactly why we're here. That's what keeps us all going, I think, whether Dr. Sarah or me. It's how do we solve, using digital health and technology, these big problems that are related to women's health.
Dr. Sarah, final
Can I just
thoughts?
add?
Yes,
Yeah.
of course.
Yeah. I think one thing that digital technology allows, and it's something very simple, but a huge majority of women can't access healthcare because of physical accessibility issues. And what technology allows is for them to just talk to a doctor or a midwife or a medical health specialist through a phone, through their feature phone, through their smartphone. But just the ability to connect to a doctor before reaching a point where they have to be taken to a hospital when the disease becomes so worse that the help then is just curative and not preventive. So just adding on to the thought that Lena had, but it just gives that ability to connect when before the time of facing the consequence, which could have been prevented at a primary healthcare level. So I think that's what technology does. It's a great enabler and it's a great equalizer for a lot of women globally, and especially in a country like ours, where physical accessibility, because of cultural constraints or economic constraints, is always a question.
Absolutely, thank you. Final thoughts, Dr. Hanan.
I think beyond all of what was said, and I echo it, is to see that modern medicine, holistic health, whatever your cup of tea, becomes a truly gender neutral space where it doesn't matter if you're a woman or a man or anything in between, but equal opportunity for all genders, all races, accessibility, as practitioners, as patients, equal for all. It's cheesy, but that is my dream.
Thank you. Dr. Hawa, final thoughts.
Engage. We need women to engage. And I don't just mean seeking health, which is absolutely true. That's why digital health is used by a lot of women, but also engage on every level of society, whether it's policy, whether it's clinical, whether it's being a midwife, whether it's sitting in a majlis and chatting with your friends. Engage, engage, engage. I see too many women shy away. It was my nature when I was a child. I never thought I was smart enough, and that wasn't even, the natural environment. That was just me. My personality is to withdraw, and I have to fight that. And alhamdulillah, nurture taught me to step forward, engage.
Okay, we have a lot to think about. I think our speakers have really given us amazing contributions. Thank you so much for your insights, for inspiring us, for taking us back in history, making us look towards the future, helping us understand where women fit in this whole discussion. I really am very grateful for your presence, Dr. Hawa, for our panelists who joined online. I wish you, I hope to see your success. We will certainly follow through with you and look out for all of your successes. Dr. Hanan, thank you so much. It's really, I think it's critical for us to hear perspectives like yours. Your expertise helps us remember where we came from, and we have a lot to be proud of. And that should always, our efforts should be rooted in that pride. For me, it helps me push forward with, so much more. Thank you to our audience for joining us, our virtual audience, our physical audience. Thank you so much for making the time today. And with that, it's a wrap.